people, you're welcome to another episode of Nursing with Abby. How are we doing today? I trust today meets you well. Today we're going to be talking about non-therapeutic communication in nursing or of nurses. Now, remember that we talked about therapeutic communication in nursing. In case you've not seen that video, I'm going to put the link in the description box below for you to go through it. So today is the concluding episode of that particular series, therapeutic and non-therapeutic communication in nursing. So we're going to deal with non-therapeutic communication in nursing. Before we go ahead, I'd like to thank all of my subscribers. Thank you so much for the love and support. I really appreciate your presence. Thank you so much for always supporting this channel. Thank you so much. I appreciate you. Now, if you're watching me for the first time, you're welcome. My name is Nontherapeutic. I'm a nurse, I'm a midwife, I'm a public health advocate, and I love what I do. On this channel, we talk about nursing, we talk about lifestyle, and we talk about everything in between. So today, like I said, we're going to be talking about non-therapeutic communication in nursing. Now, non-therapeutic communication is just a method of communication that you should not use for your patient or your client, okay? That's non-therapeutic. Remember, we talked about therapeutic one that has to do with a lot of terms like reflection, open-ended question, broad opening remarks, and all that. Make sure you check the video to update yourself on that. So today we're going to be talking about non-therapeutic communication, and I'm going to be giving you 8 non-therapeutic communication methods that you should not use for your patient or your client or your guest, that's not good. That's not what a nurse should do. Okay, so the first one is false reassurance. False reassurance is a no. Yes, it's like a no. Don't even try reassuring your patient falsely. Okay, a patient who has been diagnosed with cancer and you keep telling the person everything will be fine, I know you will get a miracle or something like that. Please always be realistic with your patients and stop raising their hopes. Okay, stop giving them false assurances, because that's not your job. Okay, your job is to show empathy. Your job is to help them through the process. Okay, helping them with their medication, making sure that they get the right dosage and they are given the right drug at the right time, and making sure that you're able to attend to their needs, but not reassuring them falsely. Okay, that's wrong. The next thing is passing judgment, either approving or disapproving. Now that's very wrong. That's very wrong for you to pass judgments. Okay, why did you allow yourself to have so many children? No, that's not right. That's not therapeutic. Okay, it's not what's my business in your family matters. No, those are, especially when you have to talk about something that's to do with a why. Why is judgmental. The word why is judgmental. Why did you have to allow yourself to be so beaten up before you could appear or report to the hospital? So those are the things. You should not use a why. Okay, you should just portray your displeasure. Maybe if you notice that the person did something that was not health related, or is not beneficial, you can't express your displeasure, but not like why is like an attacking word. Okay, why it looks like you're attacking the person. Okay, Mrs. Yinka, as much as we're gonna give you the accurate treatment even for this particular condition, but with advice, or we suggest that any other immediate early signs or indication of this particular condition should be reported to the hospital promptly. That's much better than saying, why didn't you report in the hospital? It's none of my business that it took you this long. Okay, that's too judgmental, and it should not be said off by the nurse. Now another one is giving advice. That's not your job. To give advice is not the job of a nurse. Okay, I advise you to pick this particular method. I advise you to pick this particular medication. I've also used this medication before and it worked for me. No. That's not therapeutic. Okay, even if the patient has to ask you, Auntie Nurse, Madam, please, Nurse, please, what do I use? Which particular medication or whatever do I use? All you can just tell her is, these are the various medications that are available, as the doctor has told you, and these are the side effects of the drug. So it's left for you to choose. But considering your medical condition and considering what we talked about, we give the suggestion of picking out of these two, which is very therapeutic for you and better. Okay, not saying that because I've used this one before, I advise you to use this particular one. No, that's not right. Okay, another one is close-ended question types. Now, that's not very therapeutic because you won't be able to know a lot more about the patient. When you give a closed-ended question, like, would you like to eat now? Definitely the person will give you a yes or no. But if you ask a question like, what variety of food would be of interest to you this afternoon? Now, this question will require the patient to ponder a bit and give you some answers that can, elicit more information. A person asking me what variety of food I would like to eat, I can think for a while and say, I feel like eating something that is starchy, but because of my condition, I think I'll take more of the proteinous type, which include legumes and nuts. Okay, so you've been able to make the guests or the client reflect or ponder upon the fact that truly you like starchy foods, but now you know that your health condition might not accept you taking such foods. And then you have to go to the more healthier ones, which are proteinous in nature, and specifically the examples that are actually advised. Okay, so that's a very good way of trying to make sure your patient is involved in the plan of care and making sure that you arrive at your desired goal. Another one is, like I said, the why question. Yes, I'm going to have to put this in emphasis because why shows a form of putting the patient in a defensive mode. Okay, why do you have to do this? Why do you have to pat the baby at the back? Why do you have to lift the baby up at this time? Why didn't you put up the side rails? All those questions are defensive in nature, and it's not therapeutic. Sincerely, it's not. Then another one is leading or biased question. Yes, there are some questions that you think that they are therapeutic, but they are leading or biased questions. For example, you want to get a health history from a patient, and you ask the patient, you don't smoke, do you? Definitely that question, we're going to throw the patient off balance, and the do you could be a yes or a no. So you can decide, okay, because you're already judgmental in the kind of way you ask the questions, let me just give her a no. At least she can't see it in my mouth that I smoked maybe yesterday or day before yesterday. But you could ask the question in a more therapeutic way, saying that how many smokes of cigarette do you have in a week? So the guest will definitely give you an answer that could include, I've never smoked in my life, or I take occasionally, maybe once in a month, or I'm a chain smoker, I smoke like every day, 6 packs or thereabouts. So you have a variety of answers that the patient will give you according to, but not being in a defensive manner or putting the patient on the spot. Let me put it that way. That's what we call biased or leading questions. Now, the last one I'm going to talk about is changing the subject. Yeah, this is very common for a lot of people when they notice that the question does not sound maybe appropriate enough. They would like to change the subject, which is not right. We need to present reality to our patients or our guests or our clients, and that includes especially to the mental health nurses or mental health practitioners. For example, when a patient is trying to tell you that I'm hearing voices, and all you want to do is, let me get you your breakfast. You have evaded the question to something else totally different from the question the patient is asking or the comment the patient is making, expecting an answer from you. Now, you could present reality to the patient, which is one of the various factors or various forms of therapeutic communication. So you could tell the patient that, okay, I admit you said you're hearing voices, but I'm not hearing any voices, and I'm right here with you. Okay, you have presented reality to the patient, saying that of a truth, you tell me you're hearing voices, no problem, but I'm here with you and I can't hear any voices. Okay, then you can now switch to whatever you want the patient to do. Would you like to take a seat while I serve you your breakfast? Okay, so you didn't evade the question, you actually answered the question with your own understanding, and then you presented maybe a change of subject or a change of line of thought or ideas and all that. So these are the methods that I have for non-therapeutic communication. Please ensure as nurses that we do not use this method of communication because it's not therapeutic enough and it does not show our nursing practice effectively. Okay, so till I see you in my next episode, please make sure you keep the comments coming in. Make sure you like, share and subscribe because it will help us grow this community together. And then we are preparing ourselves not only for nursing exams but also for NCLEX, and we're also preparing ourselves for being practical and efficient nurses even in our practices. So thank you so much for another episode. I'll see you in my next episode. Sure to see you in my next episode. Thank you so much. From here, signing out now, Nursing with Abby. Bye for now.